Hello, this is Dr. Brandon Blood again, and we are back today to discuss sciatica. Sciatica is a very common complaint that we see in our office on a day-to-day basis. And when people come in with sciatica, the symptoms generally for them relate to pain in the lower part of the back, shooting maybe into the buttocks or down the leg into the foot. It can also have numbness and tingling in the leg, either one or both legs, or into one or both feet. But there can be several causes of sciatica, so we're going to try to get you a better understanding of what sciatica is and where it can come from. So one of the first things that when we have sciatic type pain, we look at some nerves that could potentially get pinched in the lower part of our back. Now on the left side of this screen, this is a side view of our spine. So we have our bones and we have our discs in between. And then on the right side of our screen, we have, this is a top-down view. So basically what this view is if we cut right here and we look straight down on it, this is what we're going to see. So we're going to see our disc, which has two parts to it. The inner part's the nucleus, the outer part's the annulus. We're going to have our spinal canal, which contains the nerve roots from our spinal cord that will give way and exit out of these holes on each level of the spine. So a common cause of sciatica that we can look at is what we would consider a disc bulge or a disc herniation, commonly referred to as a slip disc. So what can happen with these disc issues is the inner part of the disc, the nucleus, can start pushing outwards against the annulus, and then at the point in which it can come in contact with the nerve root, the nerve can get irritated and inflamed. Now when we get this irritation to the nerve root, we will get referral pain down in the path in which this nerve root supplies into our leg. So a common distribution of nerve pain from an L4 herniation or disc bulge that's putting pressure onto that, it has a very precise distribution of pain into our leg. So in this case, the L4 nerve is herniated, or the L4 nerve is pinched. It comes out of our back, it wraps around our thigh, crosses at the knee, and goes down into the inner part of our foot. L5 nerve has a slightly different distribution. It stays a little bit further off to the side. It doesn't necessarily cross the knee quite like the L4 did. It comes down to the top of the foot. And then we can have an S1 pinched nerve, which comes out of the back. It generally stays more posteriorly or on the back side of your leg and will go to the outside part of the foot. So a lot of times when you see your doctor and they ask if you have leg symptoms, they will try to decipher based on the pattern of referral which level may be involved. So that's one pretty common cause of sciatica. Now another common cause of sciatica that we can look at is something we call piriformis syndrome. And when we say piriformis syndrome, the piriformis muscle is a muscle that we have on each side of our lower back and our butt area that ranges from our tailbone over to our hip bone, and when it shortens, it helps us point our foot outwards. Well, conveniently, right below the piriformis, this large sciatic nerve will pass out, and if we get a lot of tightness in this piriformis muscle, it can irritate the nerve, sending pain down to our lower part of our leg. So these two would be the most common sciatica conditions that we deal with, one being a pinched nerve out of our lower back, whether it's from disc degeneration or disc bulging, facet hypertrophy causing stenosis, as well as piriformis syndrome coming out of our buttock area, irritating the nerve, giving us symptoms down the leg. So I hope you found this video informational and valuable, and proper evaluation and treatment can help determine with what you are dealing with. Please leave feedback if there's anything else you would like us to try to explain for you. Hope you have a wonderful day.